It looks like
Thank
some
you.
good news at last from Spain. Just tell us what it's like at your hospital. Are you starting to see a difference?
Yes, we've been. Good morning, Rosa. Thank you for contacting us and let us tell you what's going on. So, for the first time in a few weeks, we're starting to see a decrease in new infections. Also, a decrease in mortality since we adapted treatments to treat what seems to be the main complication of coronavirus, which is an uncontrolled immune system response that actually creates a storm, an inflammatory response that's really what is really damaging patients. And now we are providing treatments to block that, and it seems that's having an effect.
And over the weekend, have you seen a difference in the number of new patients that are coming in with the infection?
Yeah, there's a progressive reduction. There's a severe lockdown in Spain, and very severe in our region where we live, in Catalonia. So we're indeed seeing less new cases.
So as far as you can see, the lockdown seems to be having a direct impact on at least the number of people who are getting ill in the first place.
Oh, it is, and it's actually saving lives. That's why I'm very much supporting lockdown, and because once epidemics like this hit, they grow at an exponential manner, and then what happens is that initially you have very few cases, and then you underestimate what's going on, but in 1 month and a half, you might have more than 50,000 cases, and this is what is really endangering our healthcare system. So in percentage, more than 80% of people do well, but a lot of, like 20% of a lot of people is what really, it's really putting the healthcare system under stress. So we have to reduce new infections, and the only way of doing this is by severe lockdown.
Just finally, I know your hospital has been running trials on particular antiviral medicine that's been used to treat people with COVID-19. How's that going? Are you seeing promise from that at this early stage?
So this is very early stage, but we are using hydroxychloroquine to try to prevent new infections. There's some preliminary data from very small uncontrolled trials in France, but nevertheless they look promising. But we're using that for sure. And in addition, we are now involved in coordinating for Spain a big NIH sponsored trial in which we will be testing different antivirals.
Thank you very much for your time at such a manic period. Dr. Roger Paredes, head of the Infectious Disease Unit at that hospital in Barcelona. Really appreciate it.